Okay, we're live. Okay, so thank you guys for joining us tonight. We're coming live from the DMV. We have tonight is advocacy, and tonight is Thursday, April the 4th. We have a very interesting show. We're excited. Tonight we're missing a co-host. Crystal is on vacation. So Crystal, we hope you're enjoying your vacation. So tonight is me and Bunny holding down the fort. Bunny is my co-host. She is from the DMV. She has three kids. And she has a grandson that's autistic, Grayson. We call him Gray Bear. So we definitely, Bunny, tell us his age again. I can't remember nobody's
Grayson is six.
age.
He'll be 7 in June.
Okay. So, my birthday's in June too. Didn't know that. Okay. And then my name is Paula. I grew up in DC. I live in Maryland. I have two kids. My son is 24 and my daughter is 19, going on 20. And she is autistic. She has multiple disabilities. And so I was a single mom. Bunny is married. I'm married now. Been married almost 3 years. So that's a little bit about us. So now we have a ABA therapist with us. Her name is Brittany Mabry. Am I saying that right? Good.
Yes, yes.
Okay, I did it. I did it. So of course we want to get right into our subject for tonight is having a conversation with an ABA therapist. I'm excited. Bunny's excited. I'm just so excited to learn. So for those that's joining us, send in your comments, but we're definitely get ready to turn the floor over to Brittany. Brittany, welcome and thanks for joining us. The floor is yours.
Thank you
Welcome,
so much for
Brittany.
having me.
So tell us a little bit about yourself, where you grew up and everything, and then go right into what you do.
Well, before Brittany starts, I want to let you guys know Brittany is amazing. She is Grayson's BCBA,
That's
and she comes
right.
to the house weekly to work with him. So thank you, Brittany, and welcome.
Yes,
Turn it
thanks
over
for
to you.
mentioning that, Bunny. I appreciate
Yes,
that.
I love race. Yes, I. My name is Brittany. I was born in DC. I grew up in the Midwest in Ohio, and I
Mm.
now live back in the DMV area. And yeah, I kind of have lived in a lot of different places, but here Maryland is home for me presently. And yeah, I've been a BCBA now. I've been in the field of ABA for about eight about 8 years, and prior to that I actually worked in early childhood education and development.
Mhm.
So I was a pre-K teacher. I did, early learning centers, things like that. And so I always say that child development is my first love. Like, so
Okay.
I still consider myself to be a child development professional. Um, and as a BCBA, I do ABA therapy. I do clinical ABA, which a lot of people might be more familiar with, is where we work with a lot of times individuals on the spectrum, and then a lot of times our kids also have other disorders as well, that comorbid with autism. And then so that's like clinical ABA. Then I also have worked in schools as a behavior specialist in the public school system. And that's not autism specific. A lot of times we just work with kids with behavior challenges, we'll say. And then I have also done some volunteer work with nonprofits trying to help make differences for kids, and like after school programs and things like that. So worn a lot of hats over the years, but it all comes down to trying to provide support for kids and families. That's always I think of myself as a service minded person. So I'm a servant first. So
Okay.
that's my sort of a little bit about me background. Um,
Mhm.
and so yeah, I get a lot of questions about ABA when I tell people that I'm in that field, and so I just did write a few notes to share with people, because I know that a lot of people sometimes are a little bit confused about what ABA is, what it does,
Mhm.
how you get it, if you should do it, does my kid need ABA? And so I did like come up with a few notes about that. Um, so I can kind of start off with kind of explaining what ABA itself is.
Okay.
So ABA stands for Applied Behavior Analysis. And I usually like to break that down piece by piece because it's applied, meaning that we work on things that are meaningful in everyday life. So, I mean, we could teach somebody to walk backwards on their hands. But why? Why are we doing that? Is that something that's going to help somebody live a better life?
Mhm.
So we don't do ABA just for the sake of doing it. There has to be
Mhm.
something to that. Um, behavior, meaning that we work on things that are observable and measurable. So I like to say it's a behavior, we define it as a verb. It's what you do. There's a lot of times people think that when we say like applied behavior analysis, that they think that we're just working on reducing negative behaviors, and that's not actually the behavior reduction is a very small part. Usually, if we are dealing with severe behaviors and things like that, if with any luck we start to see improvements on those things within a certain time frame during treatments, and then we can go on and work on skill acquisition and things like that. So I work primarily, my focus is skill building. That's what I like to tell people. I'm a skill builder. I like to teach
Mm.
kids new skills. um, I and I actually in college, we didn't have, in my undergrad, ABA wasn't, it's kind of a newer field. We didn't have an ABA course. That wasn't, but we had a course called Psychology of Learning. And I think that
Mhm.
that's a really kind of a good way to look at like ABA, because that was like, it's like just an approach to learning. So a lot of times people think that with ABA that you have to, that it's specific to autism. It's not autism specific. There are lots of
Mhm.
different things that you can do with ABA. You can do fitness, like I said, in the
Mm.
school systems. I did a lot of work on kids with emotional behavioral disturbances, things like that. So there are lots of applications for it. Autism is where it's most widely used, but there are definitely other applications for it. And then the analysis part of ABA is just that we use data. So, and that's sort of what is kind of the crux of ABA, is like data or it didn't happen. So we are tracking whatever we're working on, we're tracking it to see if we're actually making improvements with behavior,
Mm.
with the skills. And if we are not, then we're like, okay, we need to go back to the lab and we need to change it again. We need to take a second look at it. And so that's always in any type of ABA, there should always be a graph. There should always be some data. Somebody
Mhm.
should always be evaluating and saying, okay, are we improving or are we not improving? And if there are no graphs with your ABA, you're not they're not doing it right. So just
That makes sense. That
yeah,
makes sense.
definitely,
Mhm.
definitely. And I think that's one of the things in ABA we say, like, because a lot of times our perception can be skewed. We can think that something is happening, but it may not be what we think is happening, may not actually be what it is. So that's why we take the data to say, okay, well, I feel like this behavior is getting better, but let me see,
Mhm.
so that's really why the data collection is really, really important. It allows us to really prove whether we're actually making improvements. um,
Now,
so
how long have you been doing this, Brittany?
ABA, I have been doing ABA specifically. I have worked as an RBT. I started that in 2016.
Okay.
Um, and I actually, before that, like I said, I was a pre-K teacher before. And
Okay.
so I was saying a little earlier that I kind of got into the field of ABA because as a pre-K teacher, I was definitely had, of course, children with not just kids on the spectrum, but lots of
Mhm.
other types of disabilities. And I remember specifically, though, remember having a kiddo that was had some very, very severe behavior. I mean, this kid
Mhm.
was like breaking windows, like severe
Mhm.
behavior. And I remember them getting having an ABA therapist come in and really help us because we were having a hard time trying to figure out how we could support this our kiddo and also keep the classroom safe, and it was a really really big concern for us. And so they were really able to come in and just like it was a world of difference. And at the time, I didn't even know that the person was getting ABA. Like I didn't know what ABA was. I was just like, thank you. Like that was great.
Wow. Okay. Okay.
And so it wasn't even until but I just remember that so distinctly. And it wasn't until a couple of years later when somebody brought it up to me when I had finished my undergrad work, and I was like, I don't know what I want to do next. And they're like, I think you would be good at ABA. You should try that. And I was like, okay, I'm gonna go check, do some work as an RBT, and that's how I kind of got into the field. I spent some time doing the work, and I
And what
love
is an RBT for those that may not
Yes.
know?
Yes, RBT is a registered behavior technician. So, in clinical ABA models, you will have usually two professionals that you would work with or come into regular contact with. So, you have an RBT, which is a registered behavior technician. That is in our field. That's sort of the entry level position,
Mhm.
and that's the person who's going to come out and come out to the house every day and actually do the interventions. And you also will have a BCBA. So a BCBA takes a little bit more work. You have to pass a board and take exams in order to become a BCBA. And the BCBA supervises the RBT. So typically you would see your RBT um, every single, like maybe like 3 times a week or 4 times a week, whatever the prescription for services. The BCBA is a board certified behavior analyst. That's what that stands for. And you would typically see, like I'm a BCBA, you would typically see me like usually once a week. Maybe less if you have a lower dosage of hours, because everybody doesn't need a massive amount of hours for ABA. Some kids are getting much smaller doses of ABA, and so you might see a BCBA less in that case. Some kids might be getting more like 25 hours of ABA. It really kind of depends on the individual. The ABA is very highly specific, person to person. So, but yeah, those are the roles in the field of ABA.
I never knew that. I mean, I never knew that there was a difference. Now, is there, I know you said that the RBT is like an introductory position in
Mhm.
that. So, how do you graduate to the BCBA?
Oh, yeah. So an RBT, to become an RBT, you just need you have to do a 40-hour training. We
Okay.
usually take people with bachelor's degrees. Sometimes people will have a little bit of school and have some time left to finish their bachelor's degrees. And to become a BCBA, you have to complete a master's degree in a field
Oh.
related to ABA. You have to complete 1,500 to 2,000 hours of field work. So that's
Hmm.
like hands-on work. You have to do direct with a client, and also you have to be supervised by a BCBA. So you would be doing like BCBA type work. So that means that you're looking at program books and you're making decisions about the programming and how services and things are going. And so that usually would be you have to do 1,500 hours, and then you have to pass a really super duper hard exam.
I could
So
imagine because
yeah,
you're working directly with people. And I
yep,
know
it's rigorous.
for my daughter, I don't think she's ever had ABA, but I think she's had something close because she was in a behavioral study at one of the institutes in Maryland. But it was like more so just, it wasn't addressing her behavior, it was kind of helping her to communicate, which
Mhm.
of course could be a driving force to kids having
Yeah.
bad behaviors.
Yep.
Mhm.
And
Mhm.
communication actually, some little known fact, that's actually usually the very first thing that I work on. So a lot of times
Okay.
when we would bring a kid into ABA service, we look at a couple of different domains. We look at their social communication, adaptive skills, and then
Mhm.
also behaviors if they are having, they have like some maladaptive behaviors.
Mhm.
So the communication is usually the very, very first thing. When I bring in a kid, I'm like, okay, how can we give you a functional method of speaking? Like whether that means using verbally. Some kids aren't going to develop verbal skills. So can we use pictures? Can we
Mhm.
use signs? Can we use idiosyncratic movements? That's actually something that I've done with the kid before, is just like, okay, well, this means eat because they can't do this. Okay.
Wow.
So yeah, the first thing that I always do is try to figure out like how can we get you, because that's empowering.
Mhm.
And so when somebody is able to communicate, then they are empowered to live, and that's live their best life. And that's always my thing. My goal is always to empower. As an ABA therapist, that's always the number one thing. So yeah,
Mm.
communication is almost always on it's at the top of my list. That's what I always start with.
Mhm.
And we usually work on several things at once. We can work on communication skills and social skills and life skills. We can teach kids to dress themselves and brush their teeth and take showers and things like that. We can things like tolerating putting on lotion. So some kids have sensitivities; they have difficulty with that. And so we kind of go through and look at the things that, okay, what are the things that this kiddo needs to make their life for life as fulfilled as possible. So we kind of try to look comprehensively and say, okay, how can I help? And so yeah, we the usually the communication skills, and then I also a lot of times will look at the behavior reduction concurrently, especially for the kids with more intense behavior. So if we're doing something
Mhm.
severe, like we're headbanging, or we are I've had kids do self-biting or aggression, property disruption, like, so I will usually try to attack those two things like head on, because typically the communication and the behaviors are directly related. So once we're able to replace a lot of those negative behaviors with functional communication.
Mm.
And once they have functional communication, a lot of times we see those behaviors go straight down.
You're
Almost.
absolutely right. And I will say that I feel like I'm a behavioral therapist. Maybe I'm not, but
Yeah.
I feel like I am in a lot of it because I observe my daughter so much. Number one of the things that I try to do is to locate the trigger, like
Hmm.
what's the trigger? What,
Absolutely.
yeah.
Yep.
And I think for me, once I know that, then I kind of know how to deal with the behaviors because I think as we were coming up, behaviors were dealt with one way. I didn't know. But, I do say with a lot of the kids that's on the spectrum, and like you say, I think sometimes we think that the kids on the spectrum are the only one with behavioral problems. And I'm glad you mentioned that because they don't. It's not. And so if you try to deal with some of those things, um, the same way. It's like, how are you really accomplishing a goal? It's like for me, it's a mind game for me with my daughter. I mean, even though she's nonverbal, I do know she understands. So
Yes.
once I'm identifying what she understands, then at that point I can, kind of figure out how I can make this beneficial for her to really do what I need her to do. But at the same time, she's 19, respecting her choices.
Absolutely. And you hit the nail on the head too, because that's a kind of the cornerstone of ABA, is that we try to look at we call it the function. So we're like,
Mhm,
okay, what's the function of this behavior? What
mhm,
what are they trying to gain from this behavior? Because a lot of times the behavior is just it's a form of communication.
mhm,
So
And
especially when
attention.
we're dealing with
mhm.
difficult behaviors, like, okay, well, if I had words, I would use them, but I don't have words. So
Yes.
this is what is my way of communicating. And so a lot of times if we can get to the function of the behavior, then we can address the behavior at its core. Something that I is a kind of a cornerstone is that we use what we call like replacement behaviors, which is
Mhm.
where we say, okay, let me teach you the more appropriate behavior. So like
Mm.
you are throwing a tantrum because you really want this cookie. right? And you don't know how to tell me that you want this cookie. But if I cry and I kick my legs, it's like, okay, you're going to do something to try to help me solve this problem that I have.
Mhm.
And so something that we do a lot is say, okay, look, you can ask, you can say cookie. And then a lot of times we work on prompting strategies to try to lead into that. Because I always tell people, that my goal as the therapist is always, or the interventionist is that I want you to win. So if you can win, then you can contact reinforcement. You can learn that there is that there's something else. Hey, this works. You don't have to yell and scream to get this. You can give me the sign. You can hand me a picture. You can, so, or whatever the case is. So we always try to look at the function and try to find a more appropriate way um, for for them to communicate that need. And I also wanted, like, it's important for me to clarify too that when I say a more appropriate way, I do not necessarily mean like a neurotypical way. It is
Mhm. Mhm.
okay. I don't have to fix every single, fix, and I say that in quotes because like it's okay. You can stand. You can flap your hands. That's okay. I don't. That's not something.
Mhm.
And that's what I was getting back to, like the applied part. I don't need
Mhm.
to address you flapping your hands unless it's like impeding something. Why are we
Yeah.
addressing that behavior? And so when I say a more appropriate way, I mean something that is going. I'm talking specifically to very disruptive behavior. So things that are like you can hurt yourself. You can hurt
It could
somebody.
be harmful, like
Yeah.
harmful.
You can,
Yeah.
or can cause damage to property and to people.
Mhm.
So that's a really important distinction, and I think that I try to make sure that people understand that about is
Yeah.
that it is okay for you to be you. I am not trying to take away your beautiful shine and all your cute quirks. I love them. Like it's great. It's really
And that is so true about you, Brittany, because like I said, Brittany works with Grayson. Grayson started ABA when he was about 2 years old. And I did not know how to communicate with Grayson because he was nonverbal. And ABA introduced the pictures. It was PEC, Pictures Exchange Communication. Is that
that's
it?
correct.
Okay, PEC, PEC.
Yeah.
And I'm like, what is that? We had sticky notes, posting notes with pictures all over the house. But that's how Grayson started communicating with pictures. And it just
Wow.
involved to some sign language gestures and things like that. So yeah, there are so many ways that you can still communicate with your nonverbal kiddo. You just got to take the time, and ABA is definitely helpful. I know we've got a question in the chat.
Yes.
Oh, she's putting it up there now. And then
Yeah.
after you answer this question, Brittany, I want to really hone in on the benefits of ABA. I know there's some pros and cons that
Mhm.
people, they like ABA, some like it and some don't. But yeah, let's jump into all of that.
Yes.
Yeah. Okay. So as a BCBA, I've experienced participating in IP meetings. Um, sorry, I'm a mumbling. Yes. So yeah, I have actually participated in IEP meetings. So there's several IEP meetings now. I'm a clinical BCBA, so there are insurances are funny about that. Whether you can, some allow you to do that, some allow you not to do that. A lot of them will make you do that on your own time. A lot of times I will participate regardless of whether the insurance covers it, because I really would like to. I feel like I can a lot of times give a different perspective that the schools might be missing out on. So I would say in terms of implementing the goals, if they are not implementing a BIP or the behavior goals, honestly, I would just I don't know how to say this. Be bold.
Yes, yes, be
Dem-
bold.
Mhm.
like you can demand, especially if you are getting a lot of reports about behavior. So if you're getting a note every day that your kid is hitting every day, and so like, okay, my kid needs a bit then, right? So can you, and sometimes I will say that the schools a lot of times can be very shorthanded on BCBAs. And a lot of times, so they may not be able to get you as quickly as, say, I can get to my clients, but they still are obligated to give you a free and fair public education.
And she
So
said the requests have been denied. So I'm assuming that she's tried to pursue that. And I don't know how that works, but is there something you could do from the outside? Can you, because I know a lot of things with my daughter, I had to request outside something from the outside to come into the schools. I
so
don't know what the
and that depends on the area. You
okay.
can I you can request that your if you have a connection to a BCBA on the outside, or an ABA team, you can absolutely request that they participate in your IEP meetings, and you
IEP
can
meeting, absolutely.
bring forth and ask them to be able to come to the table with you.
That would be
100%, you
great.
can definitely ask for that. Do ask for that, because most of
Yes.
your BCBAs are going to try to accommodate that if they can, if they're allowed to. But definitely, you and typically what I have experienced when I do get to participate in the IEP meetings, a lot of people will then ask me, right? Because they're like, okay, well, I don't know what to do about this. Do you have, advice? And it depends on the school systems, because some school systems can be very closed off. They don't want external professionals coming in. I would also ask if there's any way that, if the school system is resisting, ask them if there's any way if the BCBA or RBT can sign an agreement of sorts. If it's is this a privacy concern? Why aren't they allowing your specialists to come in into that setting? You could also ask for like a lower level, like, hey, can we just come in and do an observation? Right? I'm not
Hmm.
even asking to send my RBT in there every single day. I just want them to come in and take a look so that they can provide feedback. I like to present things collaboratively, especially as an outside professional coming into the school systems, because that's their turf. So I try to, I'm a honey type of person, so I'm like,
Yeah.
try to come from the the framework of how can I help you type of
Hmm.
thing. But I would definitely say I'm be interested to know specifically, like, more specifics, like why would a BIP be why would the request for a BIP be denied this if your child is display if they're constantly saying like, okay, well, they're displaying this behavior, like they're displaying, say it's aggression is the problem. So
Hmm.
I would think, and as my work as a behavior specialist in a school system, that's not something that I ran into in my specific the county that I was working in. That wasn't an issue, but it's hard to say specifically why they would not be allowing you to do that. But if you have access to your people, bring your people to the meeting, bring them.
Yeah.
Absolutely. I know with Grayson, um, we have the right to bring anyone outside of an attorney. You have the right to do that. Now, if you decide to bring an attorney, now that's something different, because in the school system, they will have to confer with their attorney,
Hmm.
and all parties will be at the table at that point. But you have the right to bring in a BCBA, an advocate. That's your right to bring that person in, as long as you just let them know that person will be attending.
Hmm.
Again, you cannot bring in an attorney and not let them know. As far as the BIP, now Grayson was put on a BIP last year sometime, but it really wasn't a real BIP, because you've got to have a teacher. I don't think a teacher qualifies to write the BIP unless it's
Hmm.
what special education teacher, Brittany, or the case manager.
Usually it's a
Um,
case manager that
a,
they will have to
a
try to write
crisis,
it.
yeah, or a behavioral specialist normally steps in to help write that BIP. But Kiki, I don't know why they're giving you trouble with the BIP and placement and everything. And another thing, you just start documenting everything, and you take
Hmm.
that up the chain.
Hmm.
Document and take it up the chain. If the teacher, principal, if they're not meeting your child's need, then you take that up the chain. That's what you need to do.
You become that squeaky wheel for sure, because I think for the
Exactly.
most part, that's the way most of us have gotten what we've gotten. I'm never going away.
I'm
Just
never going
understand,
away. And
never
I'm
going
always
away.
gonna have a pen in my hand, and
Yep.
Brittany knows I'm gonna type everything, and I'm gonna send it all the way up to the chain.
Yep.
I'm gonna send it to the janitor,
Yep.
and I'm gonna send it to the kitchen aid lady. I'm sending
Hmm.
it everywhere, and somebody is gonna put eyes on it, and that's how you get things moving. You can't be
Hmm.
quiet. You've got to be present and let them know. Yeah.
Hmm.
Yeah. And I would be interested too to ask them, okay, well, what other supports then are they implementing? Because there is sort of there can be a process to getting to a BIP too. A lot of times I've seen they will do like sort of like an internal meeting, internal review of behaviors, and then they might try some like positive behavior supports. And then if if they aren't seeing any improvements with that, then they'll try to do some things. So I don't know if maybe they might be like following some type of internal process in that
Hmm.
school system that they have going. But I would keep my foot on the gas on that. Like, okay, well, what are you doing then? If we're not doing a BIP, then what is it? And if it's not working, I would be documenting at every IEP meeting. Like, you can put any notes that you have on IEP, and you can always add those too. So like, I just
Yeah.
want it noted that
Parent input.
I
Mhm.
have, I'm still receiving comments every like 3 times a day, or 3 times a week, 5 times a week, of that this behavior is still occurring. So, it's not improving,
Yeah.
and so make.
Denise just put a comment. She said they hope you will just comply with what they want,
Hmm.
but you've
Hmm.
got to fight. And you really do. I am in that right now because Grayson is displaying behaviors, but there are reasons that he's doing this. But I stay in the fight. I still push. They push, I push back. So you've just got to continue to stay on them, Kiki, and make sure that you're documenting everything.
And I would even also, Kiki, I'm not sure if I gave Lisa's information to you. Lisa would be an
Oh, absolutely.
excellent person to go to your IEP meeting. And so if you don't have it, let me know and I can send you Lisa's information. This is the type of fight she look forward to.
Hmm. Absolutely.
Yeah.
Yeah. So, Brittany, let's get into, the myths about ABA, the good, the bad, pros, cons, and things like
Yeah,
that.
definitely. And there are a lot, and I will have to say that some of them are not myths. So, a lot of there's, because ABA can definitely be a controversial topic. And some of the controversy about ABA is certainly rooted in there's a kernel of truth to some of the things and some practices. We've definitely we are evolving as a field. ABA is a younger field relative to some other disciplines. And as I was saying, when I was an undergrad, and I am not that old, that when I was an undergrad, there was not like, we didn't have a course for like ABA. Like, now there's courses in college courses in ABA, but that wasn't something that existed when I was an undergrad. We had, like I said, there was a psychology of learning. It was just sort of this one class that you took as an offshoot of psychology. And that was pretty much the extent of it. But so, kind of going backwards, that ABA, you kind of have to understand the roots of ABA are in behaviorism, as told by Skinner. And for those who don't know, B.F. Skinner was a renowned psychologist, and but he was a radical behaviorist. So he believed that the basically the environment shaped behaviors, and he did his work primarily with pigeons.
I believe it. Yes,
Um,
With
absolutely.
pigeons?
Pigeons. He started with pigeons. And
Wow. Okay.
so he did a lot of work with that. And he sort of generalized that, a lot of that, to these external these external contexts, and he generalized a lot of things to humans. But it was a lot of people who like sort of took his work and ran with it in regards to working with people. And so there definitely, I think, some of the biggest things that I have heard about ABA, and I have talked a little bit about some of those things, is that we can be one is that we can be sort of robotic or cold in our practice. And so I think that there is a sort of a level of sort of, because like I said, we use that analysis piece. So there can be sort of this level of, we do look at behavior as a science. So there is a scientific component to what we do, and there are people who kind of approach that from a scientific standpoint. And I know that that can sometimes, it can come off a little bit harsh in ways. And so I am a big proponent, though. There's a movement now for compassionate ABA. And so that is something that I believe very strongly in. And so things like concepts like assent, which is consent for people who are not able to give consent because of their, age or functioning level. So the assent is something that is now actually in our ethics code. So our clients have to assent to treatment. That means that the client has to be willing to participate in the treatment. That is not optional. And so that is actually something that is, and that's a relatively newer thing that's actually come out in our most recent version of our ethics code. That's in the last couple of years. I think
the chances that somebody, I look at my daughter and you walk in the door, she's not consent to anything.
Exactly.
So right. How do you combat that type of behavior?
That's actually a fantastic question. No, I'm like lean in because I'm actually really passionate about this. So we know that somebody is giving assent, and that's what we call assent and not consent, right? Because consent is something that you are capable to give consent. Not all our clients are capable to give consent, but we are tasked with trying to determine if they are giving us signs that they are trying to. So if a client is trying to pull away from me, right, like then they're not consenting, they're not assenting to this, they don't want to participate. Some kids can actively tell you no, everybody can't tell you actively no, but so we have to be mindful of their responses to us and try to intuit that they are willing to participate in this treatment. If they are not willing to participate in this treatment, then we have to back off of it. That is not something that I don't think that was as big in the field even 5 or 10 years ago. That was something that is more recently. We've had a lot of people leaning into that. Something else that can be controversial is that we have used in the past extinction, which is a lot of times extinction can come with a lot of very negative consequences, right? Like, so a lot of times extinction is where, so we look at behavior in terms of reinforcement and how what we do is likely to make a behavior happen again, right? So we say that if whatever we do after the behavior that can reinforce the behavior, that means that behavior in the future, then they're probably going to do it again. So I can reinforce you with access to a cookie, or I can reinforce you with praise or attention. So in extinction, you would remove the reinforcement. So that would mean that if this behavior, which is always produce this cookie, which you love to eat, that behavior is no longer going to work to get you a cookie. We would have so you'd have to use a replacement behavior to get this cookie, to get that cookie. So something that we have looked at more as a field is trying to move away from the hardcore extinction, because extinction and punishment are functionally identical. I tell people that all the time. It's like we can make ourselves feel better by saying that it's not punishment, but
it seems like it
out there, it's in the same response class. Extinction is the same response class as punishment. So
but what would you in that scenario, in that same scenario with that cookie, if you remove that one action that you say is bringing on the action of them wanting the cookie, if you remove that, what would, just tell me, give me an example of what would you replace it with?
So I would either, there can be a couple of things that you can replace it with. So a lot of
Okay.
times we're looking at specifically the behavior. So it's not
Mhm.
necessarily the cookie is the problem, it's the way that you went about getting the cookie, right? So there
Okay.
could be one of two things. There could be, if they're allowed to have the cookie, then we would try to teach a replacement behavior to get the cookie, right?
Mhm.
So I really try to lean into the shaping process for
Mhm.
developing shaping those skills for that replacement behavior. um,
Mhm.
so it's not like hardcore, like, okay, well, you've never said a word before, and now all of a sudden I expect you to say the word cookie in order
Yeah.
to get this cookie, right? Like, it just doesn't work that way. You're not going to magically say the word cookie.
Mhm.
So it might be, it's like, okay, well, maybe I can prompt you to say the word cookie. Maybe I can, like I said, if even if it's an idiosyncratic movement, if it's an imitation, whatever I can do, I will try to create a prompt to help shape that response. And so
Oh, yeah.
some more recent research that's been done. Dr. Hanley has done some great research in this field, and I am comfortable quoting him because it's a really, I want people to go and look into his work. If you aren't familiar with the work of Dr. Hanley, go look at his work of trying to address these behaviors with using more shaping and less extinction, even no extinction in many cases. It's really, you focus on teaching the more appropriate skill. And it might also be that, okay, if you're throwing a tantrum, that's not a teachable moment. I can't teach you when you're escalated. So
Mhm.
maybe, okay, maybe I give in and let them have the cookie right this time at the lowest level of the behavior. And then now we need to work on shaping this behavior in a different way. Now we need to work on what is our shaping procedure. And I can teach you in a calm moment, that type of thing. Um,
I don't know
Would a
about Brittany.
replacement be a preferred
Yeah.
item? Like for Grayson, it's his iPad for everything, or his special toys. Would that be something that you
it,
would replace it
You
with?
you absolutely could, because that's the other thing, right? So say they
Mhm.
cannot have the cookie, because that's the other scenario. So the
Okay.
other scenario is that you've had 5 cookies and there are just no more cookies. Okay.
Yes.
So in that scenario, you can try to redirect to something else, right? So maybe I will try to see if, like, okay, I'm sorry, you can't have the cookie. Some recent research that has come out has been said how you don't have to extinguish everything. And that's something that we used to kind of do. It was just like, okay, you're throwing a tantrum. I'm not giving you the cookie. I'm not giving you any attention. I'm giving you nothing. And so some recent research has come out to say, like, okay, you you don't have to extinguish it. Like, if the function of the behavior is that we want the cookie, you don't have to extinguish attention because you're not giving them a cookie. So you can address them. You can come. That's okay. What we're gonna do is we're going to teach you, and we're going to try to teach you to accept, tolerate not having access to that thing. So it's okay to not give the cookie and also give them something else. Give them something that they can have. So,
I
for
like that
example, like
idea.
Grayson loves his stuffies. You can have, and
Yeah.
that's somebody with him often. Like, no, you can't dump out every single box, right?
Mhm.
That's he's a, you can't dump out all the boxes. But here, you
Yeah.
can have this one. I know this was the favorite one. This is the one you've been playing with all day. Here, you can have this one. So there's a lot of pivoting towards that, and just trying in general. I say I try to make my sessions as fun as possible. That's another thing that I do, is that
Mhm.
really, really lean into something in ABA we call pairing. And that's where you try to make yourself a positive person. So as you have to build a relationship with kids, right?
Yes.
So I
Definitely.
can't borrow from an empty account. So I have to make deposits into our my
I like
relationship
that.
with you. And then as I have made those deposits, then I can ask you to do something like not having the cookie, or to let me hold your favorite bear, right? Because I have made that deposit on the relationship. You know me,
Mhm.
and I've shown you compassion. I've shown you that I'm a safe person, that I'm not going to take away all of your toys all of the time, that I'm not going to be. And so that, and then when you build up that, the stronger that your pairing relationship is, the more that you can borrow on the relationship. And
But
so,
Brittany, I,
mhm.
I hear you and I think that is awesome. The problem is I can't package you up and take you everywhere I go.
Yes,
I can't let you stay overnight every night.
right.
So even if you're building a relationship with them, and I can tell you, I kind of see exactly like you would be great with my daughter. The problem is if you took off work or you didn't come that day, everybody's gonna pay for
Yep.
Right. No,
Yep.
that is actually a fantastic thing. And I always say this, right? That's a perfect statement because it's true. Is that
Yeah.
if the terminal goal of ABA is to work myself out of a job, right? Eventually you don't need me. And that is the point. If so we do a lot of times in clinical ABA we do what we call like parent training or family or caregiver training sessions, and what we do in that is that we try to give you as the parent the same skills. Because I will tell you something, you said it earlier, you already know I do not have a magic wand. I am not doing anything that you cannot do. And so we will a lot of times try to work with our families and try to teach you so that you can do exactly what it is that I'm doing. A lot of times it will look like play, but there is a science to it, and so I can teach you the science of it.
I
You
agree.
know,
It's definitely a science because I'm telling you, I mean, if my daughter was growing up in the age group I was growing up with, she wouldn't be, you know, how your parents say you wouldn't be able to sit down. That's my daughter because I'm not even kidding. I don't care how big you are, how bad you are. She's going to challenge you. So what
yeah.
I've had to do is, and I will say this, my husband has really helped me to look at things differently because one thing that I have found out over the years is her behaviors are generated because in most cases she can't tell me what's wrong.
Right.
Yes.
So a lot of the time the Lord always brought to fruition what was wrong. It was something, her behaviors was out of the ordinary. For instance, she started coming in hitting her head every day. And I'm
Hmm.
like, where did this come from? Now, one thing it could come from is, of course, she sees other people doing it and getting their way. We forget that they pick up behaviors, but then
Mhm.
another thing could come from if I gave her that cookie today, she knows, okay, I'm going to do that every single day and I'm going to get as many cookies as I want. And then I'm going to take it on the road. I'm going to take this behavior out in public because she knows I know I'm going to get my way. If she's giving it to me at home, I can
Yep.
just about imagine when I'm going to get on the road.
Yep. You don't need me. You don't need
No,
me because you
I
already know
do.
that. But that's
Yeah, they play
exactly
on you.
correct.
Yeah, they play on you. That's what it is. Because Grayson does the same thing. They know that they can do certain
Yes.
things to get your attention and get what they want. Definitely.
Yeah. And what I say too is that a lot of times, and that's kind of the science of the ABA, is that we'll say, okay, we look at it, okay, what say we're back to the cookie, these doggone cookies, okay? Like that a lot of times, and as parents and parents of anybody, like sometimes I need you to get out of my face. I love you, but I need you to just stop. So a lot of times I might be that I am going to give you the cookie because leave me alone. And so what we call that is like, okay, well, we've reinforced this, right? And reinforcing something one time does not magically mean that they're all gonna do that henceforth and forevermore. But a lot of times we can sort of set up a pattern of things without necessarily being attentive to the patterns that we're setting up. And so a lot of what I do in parent training too is to look at the patterns that we're setting up, you know, with how we're responding and see how we can reshape some of those patterns and relearn it. A lot of times what people don't realize too about reinforcement is that it so we kind of talk about reinforcement. I'm trying not to get too technical, but like the schedule of reinforcement is like how often a behavior is reinforced, right? So you might say you give the cookie one time, but then the next 5 times you don't give a cookie. Then the
Mhm.
5th time you give a cookie, the next 3 times you don't give a cookie. Then you do give one cookie one more time, but then you don't give the cookie for 7 times, but then you do it. So you see, what we call that is a variable schedule reinforcement. That is the best way to strengthen a behavior. Like that is actually, so when I'm fading and I'm trying to be like, okay, I'm getting rid of fading out my services, that is how I do it, by varying that schedule of reinforcement and going these really long stretches and then really short stretches. And then long stretches and then short stretches. And you never really know when you're going to get reinforced. So you're just going to keep like, and that really very much strengthens behavior. I think a lot of people don't realize that about.
I would never want you to leave. I'm always going to tell you. I would be like, listen, Morgan, I don't care if you're starting to get better, start cutting up again, come up with a new behavior.
But I did put a question. I never even would have thought.
I like that question.
That. Yeah, I like this.
I like that question.
Oh, that is there a type of therapy?
And I'm assuming he's talking about. I'm assuming this person. If you can see, it's about. Is this a type of therapy used to wean a child off the medication? I'm assuming you're talking about a behavioral medication. If you can elaborate on that, that would be great.
And so I do not touch medications at all. I don't participate in that part of treatment. So I don't know is the answer. I have worked collaboratively with kids who have been on medications, and I have worked with you who've had medications, but I can't touch them. So I have had kids who have been on medications and then have been off of medications. But I can't speak too much to that because that's outside of my scope of practice. I would say what I would recommend to people who are on medication, if you are interested in getting your kid off medication, talk to their psychiatrist or their doctor, whoever is prescribing the medication, and collect some good data, see how they are with the medication. And if you want to, talk to them about how you could possibly wean it off. And if you could collect some data on their behavior and see how it is with it or without it, and see if they'll collaborate with you on that. Sometimes they will. That's very highly specific case to case, though. I have had some kids also, though, who are on medications who stay on medications. So, I have had some kids also, though, who are on medications.
I'm sorry. Go ahead. So, I'm sorry. I was trying to answer some of the questions.
Yeah.
Now, I would also ask, like, I know that I've seen some ABA therapies that go to a certain age. Mm-hmm. Is that something that you feel as though, and I want to say I saw either 24 or 26, something like that. Is there a limit to the age of therapy?
So it depends on who you ask. So there is, the insurances put a limit on ABA therapy. So the insurance companies a lot of times will dictate how long. So I know a lot of Medicaid, they will have up to the age of 21. You have you can have other insurance companies that go up to like 25 or 26. It very much depends company to company in terms of that what's going to be paid for. Now, in theory, I don't personally think that there is a limit to when somebody could benefit from ABA therapy, but that we do know that it's more effective the younger that kids get it. So an early intervention, if the kid is getting ABA therapy at 2, I can do a lot more at 2 than I'm theoretically, I'm probably going to be. I would say you got to qualify. I will probably be more effective with a 2 or 3-year-old in making behavioral changes than I would with a child who's older, who's like 15 or 16. There's also theories out there about communication windows and things like that. So there are more optimal times for kids to get ABA therapy. A lot of times insurances, when you do have an older kiddo, they're not going to authorize you. Typically, in my experience, I haven't really seen them authorizing as much in the as much time. So like with younger kids, a lot of times we can get a lot more hours. We can get more access to, really intensive services. A lot of times the insurance companies, in my experience, I will qualify that, in my personal experiences, tend to be a little bit more hesitant. They're not necessarily supposed to, but that's just what I have actually observed in practice.
Is there an adult version? I'm sorry, Bunny, really. Is there an adult version of an ABA? Not just, maybe it's not called ABA, but is there an adult version of a therapy that an adult over 21 get of it that's not called ABA?
So I was not, to my knowledge, I don't know anything that's like as comprehensive as ABA or
Okay.
intensive as ABA would be for that specific age group. And I could be ignorant. There, it could exist, and I might just not know. Like, I'm going to put that out there. And if you know, if somebody out there knows, tell me. I'd be happy to share
Because
that
it's
with people because it's a
constantly
big question.
evolving. Yeah,
It's a
stuff is constantly
yeah.
evolving, and like you say, things are coming out about it. But
There's a That's a big question for a lot of our families. Is like, okay, how are we going to transition out of ABA services, and what's that transition plan going to look like whether they age out or whether they have mastered out, like how does that work? I have worked for a company that has disability services, and I will say that something that I am currently working on is integrating behavior analytic practices, and helping to train a lot of those other services in behavior analytic practices. So even though it may not be ABA therapy per se, that they will still have, we're still trying to train a lot of our other professionals to have that same level of intervention and to have those same have that same skill set. So for the people who are working with our adults, and because I work for a company that has like adult services and things like that as well, they don't just do ABA, they also do like day service and all of those other things as
so
well.
they're just well
Yep,
rounded in
yep.
that
It's
field.
a
Okay.
Yeah, the company I
Okay.
work for is like a toll. It's like we do a lot of disability services across the board, and
Okay.
so that is something that we have worked on because we recognize that as a need. Is that
Mm-hmm.
people do continue to need supports even
Mm-hmm.
after the age of 21 and 25 and 27, and so that is something that uh, you know I personally have a passion for that. Like extending into like through the lifespan because the kids that I first started with ABA, they're grown now.
They
Like
grow up. That's what
like
Crystal
my
say all the time. When we have our kiddos that are
Yeah,
young, they grow up into
to be
adults, and we
adults.
forget about them. Yeah.
yeah,
Mm-hmm.
Absolutely.
and we can't forget about them. They're so important.
We do have a question. Can you
Absolutely.
give a statistic? There we go. Yep.
Did you have another question, Bunny?
No, no, it's okay.
Um, So I don't have a hard statistic about that, but it is, and you know what, I could also if you're connected with the host, I can look some stuff up and like look up the hard numbers about it and share that so that you can have it. The it but it is a lot of the research that has been done specifically with younger children, but there is actually originally, and I should have like I am like pulling from deep back in my memory bank on this one. But originally, a lot of what kind of put ABA on the map was actually working with. It was not children. This was actually like adults who were in facilities, and they were not able to be in society because of like they were having a hard time in civilized society. So these people were in facilities, and they were using ABA to get using ABA techniques to get people out of the facilities and into the community. Like that's like a whole thing, and I have to look up the specific story. It's a really really great story, and I have to look up the exact name of it. But that is how actually like ABA kind of like got on the map. It was not with kids originally.
That's what I really wanted to know that because, like
Yeah,
someone
I would
said,
love to hear
they
that.
just really start hearing about ABA.
Yeah, I can honestly
Yeah.
say Morgan has had strong behaviors since she was young. She's very strong-willed, and it's carried on into this today. I have never ever been referred to ABA, and I don't know if it's from the cost because I'm so mad that Crystal missed this session because I am going to tell you what I know about her. Crystal, our co-host, is on, but one thing that she said was it used to cost almost like a mortgage. Another one of
Absolutely.
our people that used to be on
Yeah,
a regular basis,
yeah.
Jill Bunny, and she was
That was
saying
like a
that they
mortgage
had to,
payment.
yeah, they had to file it hit them so much with finances that they had it took them, I think she had to file bankruptcy. So I just think
Paying for these
about
services.
a lot of these services were services that some of our kids needed like when they were young. I think a lot of these strategies would have really helped my daughter, but guess what, she's going
Yeah.
on 20 now. Not to say it still wouldn't help her, but I would have loved to have the help of an ABA therapist to help me to understand her more, instead of just thinking she's acting out. But like Claudette, her daughter, Kendall just turned, I want to say 23 or 24, may have been older. Claudette put her age in it. But like she said, her daughter's in her 20s. She's never even, been referred to an ABA therapist. So a lot of our kids have been failed by the system when these things could have really not just helped the kids, but help the parents understand, why
Yeah.
is my child doing this?
And the
27 is Monday.
insurance companies need to do better
I
and
agree.
provide these services. Crystal put a message in there. She said that even with insurance, ABA was still extremely costly. And
Hmm.
I just think insurance companies need to do better. Thank God Grayson had Medicaid and was able to get ABA services, because I had no idea that it was, limited and expensive.
Yeah, it is very, very, very expensive. And ABA is expensive. It's not what it wasn't no was about it. ABA costs a lot of money. Um,
Wow.
the it's insurance companies have gotten a lot better about helping to cover the costs of ABA, but I absolutely, I know a family that wanted ABA. Their kid was not on the spectrum. You do need an autism diagnosis in order to get ABA in most places.
And that is
Um,
crazy.
and
That is crazy.
yeah,
My daughter was just diagnosed with autism, but the behaviors were there since she was young. So even for me, I think that's the frustrating part. And I was just telling someone that the other day. It's almost if you're not autistic, they throw you away. And it's like just because a child is not may not be autistic, may not be diagnosed as autistic, does not mean that they still don't need the services or they
Right.
don't need the ABA.
right.
It shouldn't. That's nonsense. And my daughter has cerebral palsy. That was her base, and she has a genetic disorder. But just because she wasn't autistic, she really didn't get any of this. She wasn't diagnosed when she was young. She wasn't really getting any of the services. It's
Mm.
terrible.
That's awful. That's
It
awful
is. And
because
that's something we need to fight more for. Just because my child has not been diagnosed as autistic does not, and Claudette said it perfectly. The spectrum is vast, but
absolutely,
the spectrum was vast even when we talk about our kids with cerebral palsy. Most of any type of disorder, it's not just a one size fits all. It
Right,
is.
exactly.
Yeah, and I think her doctor when we were young, she had a genetic doctor. She pulled me into the office and she said, find a way for her to be diagnosed as autistic. I didn't even know what she was talking about. She was
Wow.
just sending me messages. She said, find a way. She said, because guess what? The money is there for the autistic side. She said, but find a way for her to be diagnosed. She said, because I'm going to tell you, Paula, that's the only way you're going to get anything.
And
It's
Paula,
terrible.
the doctor said the same thing. Well, not the doctor, the psychologist said Grayson needs the diagnosis on the medical side and on the educational side. And I
Mhm.
did not understand that until he left pre-K, when he went to school and they gave him the educational diagnosis of autism. And I had no idea that you've got to have that, and that brings about resources. Now, the resources are only more resources are available to those with a certain income limit. So a lot of people don't think that, they think if you have a child with autism that you can get all of these resources are available to you. And that's
Not
not the
so.
case. It's
Not
income
so.
based. So
Yep.
please understand that a lot of the services, even if your kiddo is diagnosed with autism, a lot of the services and resources are income based.
And most of them, you have multiple. I think all of us that our kids have a disability, we can honestly say that most of them have multiple disabilities. It's not just one. So even if your child has autism. That's just maybe the tip of the iceberg. They have so many other things, and you're just like thrown away. Like, yeah, come back when you want to get diagnosed with autism. It's so unfortunate. It's so
Yeah,
unfortunate.
this has been great, Brittany. I
Oh
know
my
we're over
goodness,
time, but
Brittany.
listen,
Yes.
give the final words on, why somebody should just look into ABA if they are experiencing, behavior issues from their kiddo.
And
Yeah,
tell them how to go
definitely.
about it too, because
Yeah,
some people
yeah,
don't
Yeah.
know how to go about it.
yeah.
Yeah, I definitely, I now granted, not every single kid needs ABA, but
Mhm.
a lot of kids I think really can benefit from it. I think
Mhm.
that if you get connected with the right BCBA, the right RBT, a good
Mhm.
team, then we really can. I have seen some remarkable progress, and I would implore you to just take a look at it. And I'm not a pushy person, so that's just hey, try it out. It's really it. And you can in terms of getting ABA services, my recommendation to people is, and there is a very, very long wait for ABA services in a lot of places. There's a limited number of providers and a lot of need. Um, I would, you do a Google search, look for the people in your vicinity who provide ABA services, call everybody, get on everybody's list.
Mhm.
Because what you're going to want to do is that you want to connect to you want to have the opportunities to connect with different types of BCAs, because you want to interview. Listen, I'm a certified mama bear, card carrying mama bear. Okay, you want to you want to be able to interview with multiple BCBAs and try to see whose philosophy fits in
Mhm.
with your philosophy as a parent. And so yeah, call people. A lot of times they will put you on a wait list. They may ask for some type of documentation. You do, like I said, you do need an autism diagnosis to get ABA therapy most of the time, and you need a medical diagnosis, not a school diagnosis, and for most insurance companies.
Mhm.
So that be the first thing is, with the medical diagnosis, a referral from your provider. You take that to a company. They will verify your insurance to see if your insurance is accepted by their ABA therapy. Almost, I want to say, this might be missing. I think almost every state Medicaid that Medicaid is required to cover ABA in every state. So I think that's an important point. And so then from there, you would go and you would do an assessment and get a recommendation for hours and try to collaborate and see how you can get started with services. So
Wow. When I say Brittany, of course we've gone over, but this was an awesome session. I
Mhm.
mean, thank you so much. Thank you for taking time out of your schedule. Grayson, thank you for finding Brittany. I think
Right. We followed Brittany. Brittany left the company. I called Brittany. I was like, "Where you at now?" Brittany
it's
needs
true.
service.
This is actually true. Hit
wow.
me up and say, where you
We
at?
we need you.
Wherever you are, that's where we're going. This is true. That's
Well,
actually what happened.
I thank you so much,
Well,
Brittany.
thank you for
We
having me.
appreciate, yes, everybody is saying thank you, Brittany.
Yeah.
We may be calling you back, Brittany. We have a lot of return shows because I don't think we scratched the surface.
Right.
And we would love to have you back, if not in the future, because I know my cousin would want to be here. Krista would definitely want to be here because
Yeah.
this is near and dear to her heart.
Yes. And there's
So
a
we
lot that ABA offers. One thing that I did not know that ABA offered was the life skills, the potty training, helping to potty train Grayson, all of that, the brushing of the teeth, putting on clothes. I had no idea that that was part of ABA.
Yeah,
I
all of
would
those
love,
things.
oh my
All
goodness.
of
And
those
I work
things.
when I just tell you, I just wish you were around for Morgan. You probably would have been Morgan's best friend. I
Listen,
ain't kidding.
listen. If I can find a way to help her, I still will help her. You
Let
got
me
my
tell
number.
you, listen, give me your I will get your number from Bunny, I'm not even kidding. I'm
Yeah.
serious.
But you have to wait until Grace and say bye. Time to go.
Oh
Bye.
He
Bye.
does.
Lord.
He tells me
Oh
when he's
Lord.
like, it's time to go. He goes, bye-bye. I'm like, okay,
Yeah, when it's time to go, it's like bye, bye, and he pushed her right to the door. Bye, bye. Yeah, you've
Well,
worked me enough. Bye.
yes, yes. Well, Bunny, I thank you for bringing Brittany to the show. Thank you, Brittany,
Absolutely.
so much for all your help. And if they have questions, it can people contact you? Is that
yeah,
okay? Okay.
absolutely. Absolutely.
Okay. Well, I
Um,
will refer that for to Bunny. So if you guys would like to inbox Bunny and ask for Brittany's information so that you can get in touch with her. If you have questions, that would be awesome. Again, in the near future, Brittany, I'm almost positive we would love to have you back on the show. You are a superwoman when it comes to BCBA. We love you.
Mhm.
I'm not,
thank
yeah, I may have
Absolutely.
you on speed dial.
thank you so much. I appreciate it. I had a lot of fun. I
And
was
I
like,
think y'all may live in the same area. I'm just saying. I'm just saying.
Don't you tell me that. Don't you tell me. Well, again, thank you, Brittany, for just giving us some time this evening. Thanks everybody for participating, joining, and sending your questions. We hope to see you next week on Thursday. Of course, we're looking forward to it. Another great show. So, for all
Absolutely.
of those, Brittany, have a great weekend. All of our listeners have a great weekend, and we look forward to seeing you next week.
Yeah. Thanks, Brittany. Bye, everybody.
Bye.
bye.
Bunny, real quick, did you want to say something about our shirts? You didn't say anything last week.
Yes, yes, the shirts are available. They have been posted. Go on to Advocacy's website
Yes.
and get your Advocacy merch. They are available. They
Yes, for
are
those that have
available.
been waiting, they're
Yes,
here. Yes,
yes,
and we meant to say it last week, but yes, get your merchandise. Okay,
absolutely.
on that note, have a good one.
Bye, everybody.
Bye.